Hi there. Come on in. How are you? Okay. So I have written in my notes that you are a nervous patient. Is that right? Okay, well, not to worry. There's no need to take a seat just yet. What I'd like to do before we sit down is to spend a few minutes just letting you take a look at everything that we're going to be using today, and hopefully that will calm you down a little. Then we'll sit in the chair, and when we're ready, we'll have a look at those teeth, and if you feel up to it, a quick clean. How does that sound? Okay, good. So, while we're talking, we can take a look at the chair behind me, and that's where we're going to head when we're done here. Okay? Great. So the first two things I will be using are these. A mask and some gloves. Okay? We're all very familiar with these right now. However, I thought a pair for me and a pair for you might be useful. If nothing else, you can mess about with them. Yeah, and then I've got mine as well. But I won't put those on until just before we start. Okay. The other thing I wanted to give to you, as I'm giving them all out, is one of these. This is a tongue cleaner, so it doesn't even come anywhere near your teeth. What you would do when you finished brushing and flossing in the morning and in the evening is to grab this and give your tongue a little scrub. Now obviously the one I give to you today will be all nicely packaged up, but this one is the one I use to show people what it is and how to use it. I thought it might also be nice to hold on to mess around with, to fiddle with, if you do start to feel a little nervous again. Yeah? Take it. See what you think. Great. So, let me pick these things up as we go. I'm going to begin by putting some of these in your upper and lower mouth. And all that will do is make it more comfortable for you to keep your mouth open for longer periods of time. They will expand as we go and make it even more comfortable for you. Okay. These are some tweezers that I use to hold on to these, to put them into your mouth like so. And in they go. This bit doesn't touch your mouth. It just allows me to get to the back on both sides and the top on both sides without having to shove all my fingers in there. Okay? So that's these. They're cotton. Shall I take a look? No problem. So next, we'll then have a look at your teeth using this mirror. Okay? So the mirror won't touch your teeth either. It's just in your mouth to have a good look around. Okay? It's simply this, made of metal, but it won't touch you. Okay? And I use that to have a really good look to check everything is okay. Once I've done that, I'd like to have a tap on some of your teeth. I might use this one. It's nice and blunt. So this one does touch your teeth, okay? So this one will be showing me where to go. And I'll be tapping your teeth as I go. If I'm not sure what's going on with the tooth, I might use this one. It's slightly sharper, but just to tap, tap, tap. You shouldn't feel any pain at all with either of these. So this is the first one. It's blunt, on both ends. This one, it's a little sharper. Okay. As we're going, if it hurts, if it's uncomfortable, or if you simply want me to stop, just raise your hand. Give me a wave, and I'll stop. It's unlikely you'll be able to tell me because you'll have the cotton in your mouth, so lots of waves. Just raise your hand, and we'll stop until you're ready to start again. Or we can stop altogether if it's too much and try again another day. Okay? Once I've taken a look, if you're still feeling good, we'll give them a clean. And that again is tools like this. So, as always, the mirror will be in there to take a look. And I'll just be using this to scrape away any plaque or anything like that that's accumulated on the teeth. This is the only part that may feel a little uncomfortable. And you are the best judge of what is okay and what isn't. If it's okay, we'll carry on. If not, we can stop. Okay? The final thing for me to show you is this. So this is for suction. So literally this will remove everything that's accumulating in your mouth. And you will see it come in like this. There'll be a noise, nothing too loud, as it suctions everything for you. This will touch the bottom of your gums, the inside of your cheeks sometimes, but it's not painful. Okay? So that's this for you to take a look at. Okay? So that's everything that we're going to do today. How are you feeling about it? Okay, so behind me then is the chair, and you'll see the chair, you'll see the latest x-ray that we have and some of the tools, but I won't be using any of the electric tools today. No unnecessary noise, no unnecessary wondering what it is, what's going on. I'll simply be using those tools that I've shown you so you know exactly what's going on and you're in control. What do you say? Are you ready to take a seat in the chair? Great. Come on. Let's go and take a seat. Okay. So now you're sat down. How are you feeling? This is probably when people feel they're most nervous, beforehand. Sort of during and certainly afterwards. It's much better. So, what do you think? Am I okay to put on my mask and my gloves? Great. Remember, if at any point you want to take a break, you need to pause or stop altogether. That's completely fine. You just need to tell me, okay? Great. Let's put this on. Okay. Can you still hear me okay? Lovely. So, I'm going to put on my gloves as well. You could put yours on too, if you like. Some people do, some people don't. Most people like to just fidget with them, which is fine. As long as it keeps you happy and calm. You can do whatever. Okay. ready to go. Shall we start? Lovely. So can you remember what we said we would do first? That's right. Well done. So we're going to put the cotton in your mouth. You remember this and these, and that this isn't going to touch, but this will. So we're going to do the lower jaw first, and I'm going to start on this side. Okay, are you ready? Lovely, so open your mouth nice and wide for me. Thank you, here we go. You ready? That's great. That feel okay? Wonderful. We'll just repeat the process another 3 times, okay? Great. So this one is going to go this side at the bottom. Ready? Nice and wide for me. How's that? Okay, good. Nodding now. Third one. Okay. Upper jaw this time. Okay. This side first. Ready? Nice and wide for me. Yeah, that's really good. Well done. 3/4 of the way there. Last one. Ready? One we have left. Upper jaw again, this side. Okay, you ready? Here we go. Nice and wide. Yeah. That's great. Well done. How are you feeling now? Okay. Good. Didn't see the hand going up at any point, no waving. Clicking at me. Good. So, next, the mirror. Just to look around, okay? Do you remember? Okay. I'm going to start looking at the upper. Okay, on each side. But we'll do it one side at a time, okay? Great. So, nice and wide for me again. Not too wide that it's uncomfortable, but wide enough so I can move this around inside your mouth, okay? Wonderful. So, nice and wide. Ready? This side at the top. Okay. Mm-hmm. Okay. Okay. Relax that jaw for a moment. Looking good. The mirror doesn't touch. How do you feel about doing this side? Lovely. Nice and wide again. Okay, here we go. Okay, well done. Halfway there. Bottom next. This side first. Are you ready? Great. Nice and wide again. Okay. Great. One more side. Are you ready? Well done, here we go. Nice and wide. Looking at these front ones. Well done. Take a break. Relax that jaw. So open again for me. Just do a tiny bit of suction. Okay, ready? Here we go. Just around the bottom. Well done. Relax that jaw. Okay, how are we doing? Okay. Good. So next, remember tapping. So this is the first time we're going to touch your teeth, okay? Tap, tap. Or maybe with this side. Tap, tap. Okay? Once I've done the first one or two, see how you're going. If you're okay, we'll carry on. If you're not, we'll stop. Okay? Sound okay? Great. So the same again. Top on this side first, okay? Great. Nice and wide for me. Okay, here we go. How's that? Am I okay to carry on? Thank you. And to the front. How was that? Feel a bit strange? Okay, good. Am I okay to carry on with this side? That's great. Thank you. You're doing so well. Right, nice and wide again. This side at the top. Okay, here we go. Again, just raise that hand if there's any kind of discomfort, or even if you're just not feeling so confident anymore. Coming around the front now. Okay. Well done again. Halfway there. Still okay? Wonderful. Down here next, okay? You ready? Nice and wide for me. Here we go. Okay. I'm just going to tap that one again, okay? Okay. It's good to be sure, especially when we're in a position to get this done. It's good to double check. Okay. This side now. And what I'll do is I will do the front, all of the front. Okay, this time. So, starting from here, round to the front. Ready? Great, here we go. So, nice and wide for me. Okay. Great. Almost there. front teeth now. Nearly done. Well done. Suction that really quickly. Ready for that sound again? Here it comes. Brilliant. Nearly there. Great. Well done. So how are you feeling? We've got the cotton in place. We've had a look. And we've had a tap. Your teeth are looking really good. I can see, as with everybody, that you're cleaning well, you're looking after your teeth. I can see where I could help with a little cleaning to make sure those teeth and those gums are in really, really good condition. So what do you think? Can I have a go at cleaning some of the teeth? Wonderful. Okay, so do you remember the trusty mirror one more time, which still doesn't touch? And then we're using these ones now, okay? And they're going to go around the bottom of the teeth, inside and outside, and possibly in between if they need it, okay? There may be some discomfort, especially if the gums need some attention. But once again, you can just wave or raise your hand, okay? Brilliant. So, top, this side. Are you ready? Should we take a moment? It is the most nerve-wracking part, and you're doing so well to go step by step with me today. Ready? Thank you, wonderful. Nice and wide for me again. This side at the top. Okay, here we go. Okay. How are we doing? All right. Good. Remember, you've got those things in your hands to keep your hands occupied. You don't have to keep your eyes open. You can close your eyes if you'd like. Not sure this will make you sleepy, but if it's not something that you want to see, then that's okay as well, okay? Whatever you need to make it easier for you. Okay, coming round the front now, okay? Okay, nearly there. Well done. Yeah. Okay. Okay. How was that? A little uncomfortable. Well, the good news is they're all clean now, okay? And that's the worst of it done. Okay. This side now, okay? Ready? We'll do this side, and then we'll do some suction, okay? Brilliant, well done. Nice and wide for me again. You ready? Great, here we go. Okay. It's always hardest to get these teeth at the back. It's where we often miss all these little nooks and crannies as we're brushing and as we're flossing as well, because the back is the hardest to reach. And that's why we recommend the dental cleaning, because we can really get in there. So you can go away with lovely, even healthier teeth and gums. Okay. Round we go. Here we go. Well done. Coming round to the front again, okay? Okay. Last couple. Almost there. Doing so well. Well done. Relax that jaw for me. Open a little. I'll suction that for you. You ready? Okay, good. Here we go. Well done. Good. Are you happy to do the bottom as well? Excellent, well done. So nearly there now, okay? So, this side, this again, and this. You ready? Ah, you're bossing this now. Okay, so nice and wide for me. Okay, here we go. There we go. Again, right to the back. Okay. I think you're up to date on your x-rays and things like that. We don't have to worry. Teeth all feeling fine as well. And again, it's just those hard to reach areas. And that is everybody. Not one person comes in with perfectly clean teeth. Just want to get in here. You okay? Good. Coming around the front now. Yeah. Almost there. Doing so well. Okay. Fantastic. How are you feeling? Great. One more side. What do you think? Can we complete the set? Awesome. Ready? Nice and wide for me. This side. Here we go. Okay. Well, this side, believe it or not, is the cleanest. So it will take the least amount of time. Which is good to know. Because I suspect you've pretty much had enough at this point. Okay, working round. Great. Still okay? Well done. Coming round to the front now. And these last few teeth That's you almost done. Great, a couple more. Still comfortable? Great. Almost there. Last one. Okay. You okay? Wonderful. Relax that jaw for me. Okay. Open a little. Suction there. Ready? Okay, here we go. Right to the back. Well done. Now, let's remove that cotton. Okay. So, we'll start with the upper in exactly the same way we've done before. Okay, so this side first. And remember, this won't touch your mouth. It'll just grab the cotton. Okay. Ready? So, nice and wide for me. Thank you. That's great. Thank you very much. Next, this side. Ready? Okay, here we go. Well done. Again. Halfway there. This side for me. Ready? Okay. Well done. And one more. This side. Ready? Great, here we go. People are always ready to have these taken out. Well done. So, how was that? That's you all done. Well, I'd just like to say you did so well. So proud. You looked very, very nervous when you came in. I'm not sure we could have immediately sat down in this chair and got on with it. So the fact that you did, and the fact that you stayed nice and calm throughout, really speaks volumes about you, so well done. What we'll do is we'll schedule you in for your regular checkup going forward. But what we can do is we can do this again if we need to. So don't think you have to come in and sit down and be brave all the time, because that's not how life works. We can always revisit the tools that we're going to use, what we're doing and things like that. And we've always got that option. Hands up, making sounds at me, to stop. And if that happens in the future, that's absolutely fine. We can do this as many times as we need to, okay? So in the meantime, the only thing I need now is I need the tongue cleaner back, because you'll get your own on the way out. There's a free tongue cleaner today and some free floss as well, so make sure you grab that on your way out. But thank you for coming today. I appreciate the effort that took, so I'm really grateful. And any problems between now and when I see you next, just give us a call and we'll come back in and we'll take our time and we'll get you sorted, okay? Great. Nice to see you today. Take care. Bye-bye.